Hi, Assalamualaikum. Good morning, guys. So, this week I'm going to share with you an introduction to oral squamous cell carcinoma, in which it constitutes basically more than 90% of all oral malignancies. As you can see here, tongue lesions, white lesions with some reddish area. This can be an early presentations. This one is an advanced presentations where the ulcer is becoming bigger, and there's some roll border. If you can see, the margin or the border is raised, and if you palpate with your fingers gently, you can feel some hardness that we call indurations. Okay, and around the world there are geographic variations. Yeah, um, for example, in Southern Asia, which includes India, Sri Lanka, Pacific Islands. By the way, Pacific Islands is referring to Papua New Guinea. So in this area, Southern Asia, lip and oral cavity are frequently affected. While in Beijing, lip, oral cavity, and pharynx, except the nasopharyngeal areas, presented with oral cancer and it is the 20th most common cancer in Beijing. And part of Europe and Latin America and Caribbean also, oral cancer or oral squamous cell carcinoma is an important cancer. Yeah, when I mention oral cancer, is usually synonymous with OSCC because it's 90% of them. Yeah, right. So let's have a look at the risk factor of oral cancer. Okay, these three items here, tobacco, alcohol, and bitter quid, is the most common culprit to be blamed if the patient has oral cancer. That's why when we taking history for patients, we usually directly ask patient, do you smoke, do you take alcohol, do you have bitter quid chewing habit? Okay, because this is the common and what we call that, it has been proven that these three factors is the main or commonly found factors associated with oral cancer. For tobacco, okay, all forms of tobacco has been associated with oral cancer. 95% of oral cancer death among the men in some countries has been attributed by the tobacco use. And alcohol drinking by itself increase the risk of oral cancer 3 times, meaning that without any other factors like tobacco, bitter quid, or others, alcohol by itself is a risk factor 3 times more commonly in patients presented with oral cancer. And this factor like tobacco and alcohol, they have synergistic effect. Okay, when they combine, they have a more powerful synergistic effect, more powerful risk in order for the patient to get oral cancer. So it's very, very important, when you see the patients and the patient admit that they have these habits, at least slowly reducing one by one maybe. Okay, they can't really stop at once. Okay, it's habit, so habit is very difficult to kill. Okay, and bitter quid chewing habit also is a significant factor that increase risk of oral cancer, both independently or in combinations with cigarette smoking or alcohol drinking, meaning that bitter quid, even they alone, has a very strong factors for the patient to get oral cancer. Other than these three factors, factors like age, okay, older patients, usually above 50, is more commonly presented with oral cancer. But in recent years, there are increased numbers of patients, young patients under the age of 40 can have oral cancer. And male has been mentioned that predominant gender to get oral cancer. Other factors includes HPV virus, sun exposure, for example, patients who working outside, having exposure to the sunlight, okay, fair skin patients, okay, these two are associated with exposure to the sunlight, patients with poor oral hygiene, poor diet or nutrition, and weakened immune system, for example, have systemic diseases, okay, and infection as simple as candidiasis, okay, we all maybe have candida, but they are not pathogenic, okay. In some patients, maybe because in combination with some reduced immune system or any other factors, may have have a risk to have oral cancer. I highlighted HPV because this is very actively being research being done on HPV association with oral cancer, and they found out that in some patients there's HPV is positive for oral cancer, and for example, patients that have active and multiple partners of sexual activities, those practice oral sex, early sex debut, and having sex with someone who has HPV is the most common way someone gets HPV. And some strains, HPV has many strains, so 16 and 18 has been associated with oral cancer. And they also did research on vaccines, okay, for oral cancer. Maybe some promotion has been done towards the awareness of the association of HPV and oral cancer, and the specialist had suggested that to reduce your risk of HPV infection, you have to limit your number of sexual partners, because having many partners increases the risk of HPV infection. Okay. Other than that, in some of the research, they found out that even though the patient has a healthy lifestyle except for the sexual activities, they don't have these habits, tobacco, alcohol, bitter quid, or any other strong factors mentioned here, but they have positive tumors with HPV. Okay, even HPV alone can promote or have a risk for the patient to have oral cancers, right? Let's have a look at Malaysia scenario. Okay, they did a very long time ago, in 1997, they did research, a big research, national research involving many countries in Malaysia. So Indian ethnic and indigenous people of Sabah and Sarawak has higher risk of cancer because of bitter quid chewing habit. But in Kelantan, there's a prominent Malay ethnicity being affected, and most oral cancer in oral cancer patients in HUSM. This is the research in 2009. HUSM was smokers and males. Okay, and the main site is tongue. Other than tongue, they also found buccal mucosa, lips, and floor of the mouth as the main sites for oral cancer. And there's one study, a very recent one, 2018. They relate HPV cancer or oral cancer with Chinese ethnicity. But in Malaysia, HPV-related oral cancer is not as high as in Western countries, in UK and US. OPSCC is oropharyngeal squamous cell carcinoma. Okay, previously they tend to group in the same group, oral cancer, OSCC, and OPSCC. But because of current findings, in which HPV is more related to the oropharyngeal areas, they separate these entities into two different things lah. Okay, one is oropharyngeal, one is oral cancer. So two different things now. That's a current information for you. And this is a poster for Mouth Cancer Awareness Week last year. We did it virtually. It is an annual event. This event is objectively to educate public lah, okay, tentang oral cancer. How is it important to have an early mouth examination for early detection of oral cancer. Okay, so you can join next year or 2021. Hopefully we don't have to do it virtually. Okay, all right, so when you have been diagnosed with oral cancer, you will be discussing treatments with specialists. So there are various treatments including surgical excision, chemotherapy and radiation therapy, and in many cases combinations. So but despite this advance in the treatment, oral cancer still show poor prognosis with high rates of morbidity and mortality, and the patient has low survival rate. Okay, 5-year survival rate of less than 50%. Look at this picture here. Cervical cancer is one of the complications of radiation therapy. Okay, at the cervical cancer. Cervical caries. Cervical caries. Okay, it's a specific features in patients with receiving radiation therapy. And also oral mucositis, okay, is quite commonly found in patients with radiation therapy. Look at the tongue. Patient had a surgical removal of part of the tongue. Patient may not have the usual movement of the tongue as previously, okay, and maybe the speech will be affected as well. So looking at Malaysia, majority of patients come to you when the size is already big. Okay, more than 50% come to you when the lesion is 6 cm, so big. And many have lymph nodes involvement, meaning that the cancer cells has traveled through the cervical region in which there are many lymph nodes there. And oral cancer at very late stage, okay, stage 4, okay, was most frequently presented. So that's why patient has poor prognosis because of late detection, where patients are already in advanced stage of disease at the time of diagnosis. Other factors that influence patient survival include the anatomical side, okay, the size of the lesions, the spreading of the lesions, lymph nodes involvement, the histological type. Some histology shows advanced, very aggressive tumors, and the treatment modality chosen by the patients. And this reason for patients delay maybe includes patients limited knowledge. They think the ulcer that doesn't have pain is okay, then they leave it for longer than 2 weeks without any treatment or examinations to rule out any cancers. So those are factors that delay the patient to get treatment. And some patient has difficulty accessing the healthcare facilities, for example those in rural areas, so they have limitations to get to the hospitals. So clinical signs and symptoms for early stage, this is the very important, because small lesions tend to be asymptomatic and very vague symptom and minimal clinical findings. You can't see anything, you can feel anything. Patient has difficulty to express their symptoms, but they think it's there, so difficult to examine. Okay, they are typically painless unless infected or advanced. High index of suspicion if patient has tobacco alcohol habit with a non-healing ulcers more than 2 weeks. So this patient with this type of feature, you must be aware as a clinician. Okay, and patient may present with red lesions, mixed red and white lesions or white plaques. Okay, in advanced stage, there's some growth, ulcerations, pain because maybe nerve involvement, okay, referred pain, some malodor from the mouth, difficulty with chewing, speaking, swallowing, opening the mouth, and maybe some weight loss. You can see obvious weight loss and neck swelling. In other extreme advanced cases, ulceroproliferative growth, you can see them. What does ulceroproliferative looks like? It looks like there's some cauliflower here. Okay, if you like, call it cauliflower. It's quite hard, okay, when you palpate. And this, if you may call it as early lesions, you can feel with your fingers some indurated margin.